This is the Kenyan team joining in.
Welcome to the Kenyan team. This is Dr. Mike Farkula. I'm the chair of DSM. First of all, I want to congratulate everyone on what is a very challenging study. We just want to congratulate you on all the efforts to make this the most successful study possible.
I'm thinking coffee or tea. I'm not decided. I'm going to have coffee because it's a long day. My name is Evon Okidi. I'm from Kenya. I went to Brown before to get my master's degree in biostatistics, and I came back here to work. The place where my role comes in is to evaluate the effectiveness of an intervention that we've introduced. We are trying to get people who have been diagnosed with hypertension to seek care. The intervention is, using community health workers to try and get people to care. The community health worker is interviewing Stephen, and I really can't tell what they're saying because they're talking in local dialect, but this is the reason why Study wanted to involve the community health workers, because they know these people, they speak the language, and they sort of understand the day-to-day activities. This is sort of a prime example of why we felt as a study that we needed to start care from the grassroots coming up rather than just at the main hospital. We needed to bring it down to the community. To really see if this intervention works, we are basically looking at two main outcomes. First of all, we want to see that they actually linked to care. They went to a facility. So we're trying to see, okay, of everyone that we recruited, how many eventually went to look for care? So that's the first outcome. The other one is change in their systolic blood pressure. So to assess that change, we're following them up after 1 year since recruitment. So we're doing the blood pressure at recruitment and then blood pressure after 1 year. We've come to one of our community units. It's about an hour from Eldoret town. One of the main things we're doing is follow-up. We're trying to find these people after 1 year of screening. Asante sana.
Uko na uchungu kwa roho hapa kwa kifua na kichwa kuuma.
Anda kichwa kuuma, alafu inasunguka namna hii.
Ni mingi sana, uchungu ni mingi sana.
Naomba nikupime.
Welcome to my office. This is where all the magic happens. All the data that we collect from the field ends up here. So here is where we get to see whether our communication strategy actually works. We account for several factors that might affect how our results come out. So we're looking for gender differences, male versus female. We're looking for age differences because age is one of the known risk factors for hypertension. Older people more likely to be hypertensive. This data is telling me a story of people who are very hardworking, people who, based on their responses, are sometimes torn between, your personal issues like your health matters or your familial issues. Like, should I take care of my family before my health, or should I take care of my health before my family? Like, what's more important to me? Should I go look for money, or should I lower my blood pressure? If we find an intervention that actually helps to get people to the clinic to seek care, and then once they're there, to maintain those regular appointments, then this is something that's not just good for hypertension patients. It's good for all other diseases. Like, this can be scaled up. We can find a way to incorporate it into diabetes care, into all the other chronic diseases.